Ear Infection: Things You Should Know, Questions and Answers by Rumi Michael Lee. I would like to thank and congratulate you for listening to this book, Ear Infection: Things You Should Know, Questions and Answers. This book will help you understand, revise, and have a good general knowledge and keywords of ear infection. Chapter 1. 1. Ear infection is also known as. Ear infection is also known as otitis. 2. Are there different types of ear infections? Yes, there are different types of ear infections. 3. What is acute otitis media? Acute otitis media is infection of the middle ear. 4. What is otitis media with effusion? Otitis media with effusion is an accumulation of fluid in the middle ear. 5. Does otitis media with effusion cause fever? No, otitis media with effusion does not cause fever. 6. Does otitis media with effusion cause pain in the ear? No, otitis media with effusion does not cause pain in the ear. 7. What is swimmer's ear? Swimmer's ear is an infection of the outer ear canal. 8. Swimmer's ear is also known as. Swimmer's ear is also known as otitis externa. 9. What is the most common type of ear infection? The most common type of ear infection is otitis media. 10. What is chronic suppurative otitis media? Chronic suppurative otitis media is when an ear infection won't heal despite treatment. Chapter 2. 1. Can otitis media lead to a loss of appetite? Yes, otitis media can lead to loss of appetite. 2. Can ear infections heal on their own? Yes, ear infections can sometimes and often heal on their own. 3. What are the three main parts of the ear? The three main parts of the ear are the outer ear, the middle ear, and the inner ear. 4. What are other parts of the ear? Other parts of the ear include the pinna, temporal bone, malleus, stapes, incus, semicircular canals, vestibular nerve, auditory nerve, the tympanic membrane, the external auditory canal, and the eustachian tube. 5. Can ear infections be chronic? Yes, ear infections can be chronic. 6. Can ear infections occur in all parts of the ear? Yes, ear infections can occur in all parts of the ear. 7. Can damage to the ear sometimes be permanent? Yes, damage to the ear can sometimes be permanent. 8. Can a person have a double ear infection? Yes, a person can have a double ear infection. 9. Can smoking cause ear infections? Yes, smoking can cause ear infections. 10. Can altitude change cause ear infections? Yes, altitude change can cause ear infections. Chapter 3. 1. Can an ear infection be caused by bacteria? Yes, an ear infection can be caused by bacteria. 2. Can an ear infection be caused by a virus? Yes, an ear infection can be caused by a virus. 3. Can ear infections lead to complications? Yes, ear infections can lead to complications. 4. Do children usually have more ear infections than adults? Yes, children usually have more ear infections than adults. 5. Is the anatomy of the ear in children the same as in adults? No, the anatomy of the ear in children is not the same as in adults. 6. What is the difference between the eustachian tubes in children and adults? The eustachian tubes in children are narrower and more horizontal than those in adults. 7. What does the eustachian tubes in children facilitate in regards to infection? The eustachian tubes in children get easily clogged, thereby facilitating infection. 8. Is a child's immune system as developed as an adult's immune system? No, a child's immune system is not as developed as an adult's immune system. 9. Compare the adenoids in children to those in adults. The adenoids in children are larger than the adenoids in adults. 10. Can swelling of the adenoids block the eustachian tubes? Yes, swelling of the adenoids can block the eustachian tubes. Chapter 4. 1. Can swelling of the adenoids lead to infection? Yes, swelling of the adenoids can lead to infection. 2. What is mastoiditis? Mastoiditis is the infection of the mastoid. 3. What is an abscess? An abscess is an accumulation of pus. 4. Are allergies risk factors for ear infections? Yes, allergies are risk factors for ear infections. 5. Can an eardrum tear heal on its own? Yes, an eardrum tear can heal on its own. 6. Can sinus infection cause ear blockage? Yes, sinus infection can cause ear blockage. 7. Can ear infections cause fever? Yes, ear infections can cause fever. 8. Is drinking from a bottle in a baby a risk factor for ear infections? Yes, drinking from a bottle in a baby could be a risk factor for ear infections. 9. Can hearing difficulties affect speech? Yes, hearing difficulties can affect speech. 10. Is hearing loss a complication of ear infections? Yes, hearing loss is a complication of ear infections. Chapter 5. 1. How are ear infections diagnosed? Ear infections can be diagnosed using an otoscope, audiologist, tympanometry, tympanocentesis, acoustic reflectometry, etc. 2. What is an otoscope? An otoscope is a device used to inspect the ear. 3. What is tympanometry? Tympanometry is a diagnostic test that measures the movement of the eardrum. 4. What is tympanocentesis? Tympanocentesis is a diagnostic test that uses a tiny tube to pierce the eardrum in order to drain fluid from the middle ear. 5. What is acoustic reflectometry? Acoustic reflectometry is a diagnostic test that allows the measurement of the amount of sound reflected back from the eardrum. 6. How are ear infections treated? Ear infections can be treated with antibiotics, eardrops, pain medications, myringotomy. 7. What are antibiotics? Antibiotics are medications that fight against bacterial diseases. 8. What kind of eardrops are used to treat ear infections? Steroid eardrops, antibiotics eardrops, and antifungal eardrops are used to treat ear infections. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding ear infection.